Kusampula, doctor.
Kusampula.
How are you, La?
I'm good lah.
Las. Just a brief introduction on myself. La ngai mi di pema chensom sing la. And I have this little talk show, Let's Get Real on TikTok, where I kind of get people's story and mula awareness rayu kachira berani. I kind of use this platform la. It's a very informal, relaxed show in la. So, and I'm so glad to have Doctor here with me today la.
Thank you lah.
Thank you.
Is it okay if I talk in Dzongkha lah?
Yes la, the Dzongkha English anything la. Kachira tubla.
No. Nga Doctor Ugyen Tshomo te ngagi tatu sinse lo kechi lakti amchu cancer medisu dazibe do wala. Then menchea ngagi biong dele kak thapta ni lerim gia nga kongi technical advisor se tatu gom maju sinse nga ne bedila.
Las.
Daredi cervical cancer ngegugi cancer gi nimbe jamling yung lu chu ma bala te cervical cancer gi chuji di tatonga gi gemi tegu di in la color di it's a green color and bending I'm wearing this tegola te ngemara al ngagi ani jamling gi neta chi shuwa chin la Zamling yung lubyo chin te cervical cancer di number shibai mela amchugi bulula te na ngachi lungcho Southeast Asia region na byo chin te number ni pa be chume te omgi cancer number dangpa ila jambuling lu te ngachi chimcha gakhap na lu katelue anibe mela te cervical cancer ngegugi cancer di jamling na gakhap khichi nga na chamchi number dangpa cancer me te ani gi danlu ngachi chume bala chipme ba te ani gakhap manchora ma Africa lu me te Africa lu di gachbe cervical cancer di momina siwachin malu di HIV nam semi du bala HIV cervical cancer di ngachi zugi immunity top shugi ani juila te sugi suye bachin HIV gidi sugi top shu nyungso jo telen ani cancer topni gi nebu sunale yemi chube bala hani bendigi HIV yesa gi gakhap nalu cervical cancer nam simi onla te ngaji gakhap ti Africa gi gakhap ti sugi chaplera umbe bala te cancer mi bumre lu kadimchi themmega and to compare with among countries that in Bhutan there are 80 cases it doesn't say anything but if there any bumregi nana le kechi de chi cancer top mela ngachi dulu te luncho na lu chuji changa animchi la menula the shimigi de halu se wa te cancer number dangpara in la ngachi dulu tatoya amchugi bulu tele tebada shinigi tekal hepdadi poi cancer gi maum sinula ngagi midi inloni tong chuguda kejini gi ani loji gi toking la data so cervical cancer now has fallen to second cause of cancer deaths in women so it's good news la. That means ngachigi da jimi cancer da jimi disu masura ani juba da jindo mela early da jimi so death has come down but incidence semidi ani cancer nami sap themi di ma bab majumi di chidi ngachigi screening ni dikila screening means nami manami gara disu ngachi lo sumchu songale tukchu renga chinchigi disu chichi bini wala anigi mela. So anything this is the status.
Thank you for the updates la. Thank you. My first question is actually mula like ngachi tato mi mapa ini di dana awareness di duni di du bala nga chigi ani society na lumo la ta Bhutan na bere awareness di duni di du, but there are still some people mi lalu du bala cervical cancer se mi di kachi ina ani hama kupchi du bala, so cervical cancer se labdalu kachi cervix ki cancer gadebe ani chi nagi atichi shusuba chinla.
cervix semidi ngaji amchu gi bucha gi khalu labila te ani di ngaji ani cha chu taw da ngaji gi thong bala
Yes.
te ngaji gi lap chu taw da ya da jin la te ani ludi ngaji cervix se labi te ani cervix ki ladi gachi na se wajan ngajara alu chapta alu nana dam jaung la
Yes.
sinche dam ja te alu ke da cham chi khap chiung la te ani lu ngaji cervix se labi te ani di lap ngaji gi lap chu taru dajin te ani speculum se cha chu ta ne bala ani ya dajin la te ile uterus ki cancer men la uterus ki cancer ti nazele the omba te didi in worldwide ani di mala ke khap yarge jo sale pha pe ochi khachum je am su ti su jobanin ma chap aluma ke nyamta bendigi la ngaji Thailand India katliya nana gi cancer di mala te ngaji na yo ochi te chika gi cancer di cervix ki cancer ma mi di ani HPV infection da so mani di imela.
Yes. Temula ani what are the ani the ani prevent bego bachin mula ani most effective strategies the gachira yubinala cervical cancer the ani prevent benigi tene, what are the most effective strategies la?
The cervical cancer prevent many then we have to know the cause mola. The kachidle ten jummo se wachin nebu HPV ki ten di jumme bala. And that you get from STI la. It's a STI. Kachim se wachin amsunyen chapa ma chapi pogeda diwa ira me mi disulu mitobala. So infection ime hani bendigi te we say chronic HPV infection kachim se wache amsu nyen chap simle amsu mazep chigi yani HPV infection di top ni du wala de boda masulura lo ni da sumgi nan kulu ye jong la te lo sum chu chin che ye ma jo lo sum teru ye ma jo achin te ani amsu disulu te ani cancer top ni nyen khai te ngachigi ani cervical cancer ki cause ki chronic HPV infection semidi ani te ngachigi ani kakthap ki denlu di te bum chungku lona chungku lo changale nimmenchi disul ki khapchak ola te didi ngachigi achieve bela more than 90% of our women are girls are vaccinated la since 2010 we are vaccinating 2010 lo ngachi amchu bum tongcha ngap chu de chi lu lo chu ni da chok ge gi bum di su lu khap chap chi la dele ni tong chu chi le lo chu ni gi bum di su da class 2 na chota mi bum di su da to ya khap chap ti ye te in lo ni tung ke chi le di bus di su lo ya khap chu do la te ani di primary prevention semidi HPV di mithopni gi denlu imela the secondary semidi da thop chami am di suludi tanga chi lo sumchule tukchu renga chinche lo nga nga gi bana ngachi gi ani screening semidi manami mi di sulu shipche be milu launga te nami di lu di ngachi diagnosis launga ngema be mi lo ilonya tong kechi le ngachi ani HPV testing se book tu ga tawila no book tu la these are different la
Las so there is a difference between the screening and ngachigi pap smear is also a part of screening imola
pap smear se meeting ngachi ani cancer top ni madu ga tawila
las
it's done ani di mashara ngachi migi bendigi te low sensitivity set ani nesiga yemi gara da jimi chodo mela anbengi low sum bana be bana da to HPV testing semedi namsami sensitive indigi te longa gi bana tupla te lokchilok le bemengola.
Las. So ngagi the this year ngagi pap smear be report the like normal with him but in next 5 years nga be mongo yala.
Tato gidi HPV testing si ani bup duga tawila.
Las.
This is different la. Yema gidi ma duga tanbala. Tato gidi ani cancer tok ni bup di duga. Ngagi dati swimen la chronic HPV infection. Te amsu di ko sumju haru HPV di zukhale ye majo wajin ani amsu di sulu cancer tok ni ngkai singaji ani la bila.
Las. Ani mola gachilo the ngachi ani challenge biggest challenge ani in diagnosing mola cervical cancer early diagnose benigi challenge the gachi duga and mola treatment options the gadebe vary bewinala depending on the stage of the disease.
The cancer ngachina dulu di chacha shipchu dechi stage 1 nara da jimmela ngachigi na menche nara chapchula ngachigi ani operation be shachi be operation ya daw ye lalu operation chungku chirain la lip se ani alubusa gi khacham chi tok tang la te lalu lu di ngache alubusa ra ten tang la te ngaji amsu dichu jacha shipchudechi di ngaji na ngaji nara shipchi kachilo menchi chapswela te dile achichi thesunu sewachin te ngaji ma re bewa tamila radiation bewa india lo te dile namsamira chisunu stage 4 lu lesunu sewachin te ngaji ania reya ma bewa ngaji nara ani achi yinrimbe dechuni delu palliative si kimo chuong la ma chi te ani di dani gi delu member achi te toto shanida te achi yinrimbe te chuni gi delu ani menche be la te am di chu gi te sa ja ngo cha te cha ten juru dau be lalu gi lo be men khana ma ma de mi du la ngo cha di la te ani gi be chi di o me ba tiboda ngachi na shimidi lasha ma babsila kachimse ngachi screening gi ma pa ka chube tiboda cancer yimi amdi che ngachi gi da jin bi mazip chi screening gi be da jin la te nahi gi lo sum debi gi lo sum lo inu ni tong kechi ni da sum lu di am la sha da jin la ngachi gi ani cervical cancer da nyam la because there was screening la am sugara bobe nga shipche bendigi te mi la sha da am la sha da jin la cancer yim
las la ani mola ngagi ani the usually ngagi ani ngiki ani talk show the is mostly on like ngachi mental health ki na lebe adabe imbala so ngachi gi ani hospital na lumula ani zoom like a therapy or ani zoom yoyala for patients suffering from cervical cancer and some therapy or to address the mental health struggle gi and some gi hospital na
tatu since di menkhana di mila di bola ngachi gi ani palliative care si bola ngachi cancer na di ngachi cancer na be drama chumi ngachi ko mi jabala ngachi daji be te anilu te ngachi na thimpulu be chi chimna tawa juila machi ani dis kongibe counseling da ansuya ani kongibe chika be mela ani kachira beni menia chimna ke dressing beni yiru ani catheter da ansu soni yiru kachira yiru chimna be jimila ngache na timpuludi ma khasarap chu chinchida ya kabesa chinche ganche nini ba na chare ne ta jong la che home based palliative care si bala te hani da nyam actually ani psych ni counselor ko la te ngache cancer society ki chi jai te boda ngache mo renew na ya sila te ngache hatule jagop chi du bola te mengha khatu li diro ani actually we need la
last email ani de because ngachi mo la ni da ngachi na Bhutan na di da cancer cervical na amsam nam to lang sisi gi ani bechi mo ba de mo la So ani biodalodi maybe ani cancer namisami ani stage aji first few stages na bedi bero ani chi didi namisami mentally namisami ani thebi gale didi toru henke worse junigi nyenka miga se no di langa bewajin. So mula ani
There is
hanigi chi.
stigma at Ivala. There is stigma. The cancer you say she shumle the sangajani dula. Then some husbands they leave the wives la. So some of my patients come and cry in my room. I'm pocket to koja and bella. So we need counselors, but ngaji doctor tisugi kachi be subchi ngachira be la dato. So I always tell women that the two men chap the chenam some kauchiung, the navana che migi gehachiung, the same dindi be, the same dindi be, devachin, the shego tisuya zatu, su dindi jobe, the menche chechu se and bella bella. Because especially chemo, whatever treatment you do for cancer, I mean, su dindi gola, su dindi mebachin, the menche chapisabella, menche totibe. It's very important to complete treatment la. The hanigi din Katolidi, I encourage women to same macho down tato kaucheru kimi the navanan se da navanan se migi gekhat chiung se so many of my patients just now come to me after 10 years, some 15 years, 20 years, 7 8 years. They are all normal la konro migi gekhat si jingi labe chimna labe shi chana lepa labe you become normal la the midi sugi the cancer se we galete that they immediately connect it to death la.
Yes.
The me topri topsi mishi se ngaji anibera ngaji Bhutan Cancer Society hatuli we try to inform people about this early diagnosis and importance of treatment la.
And I since ani HPV gi vaccine didi the 2010 na le gochu se suni mola doctor gi 2010 na le gochu to yobachin the 14 years jono. So I'm sure like the ani numbers have really decreased imavati mola.
It takes time to Tato ani 2010 na 18 years bemiditu just now only they've become 32 33 la. So cancer doesn't early myoma la 20s na mapale very rare la but 30s na le bomba. So just now vaccinated am sudi su dato chamchi they are joining the screening la. So it will be good to see vaccination chapmi amdi chugi kadim chigi thopmega mithobega tato di ngachi pre-cancers
Anichi nga anichi tinibi insala a little bit outside na doctor gi animula. Integrative medicine human ala the alternative healing and conventional ngachigi conventional treatment the alternative healing combine bebe cancer nalu help be mi gi ani gadebe no megala nagi susam gadebe yogala on alternative healing as well and combining conventional treatment. Na biyoshi like acupuncture da ani duswe ati ani difference re hunga say what are your thoughts in it la?
the alternative medicine is being practiced everywhere la, even in developed countries and we also encourage la ani alternative medicine da ansu kachlo and especially if women have lot of pain and all we send to indigenous hospital la. So there they do acupuncture or whatever la. The datu since the ngaji pain gi jamchi we've been sending la. But if there's a clinic in JDW, then I think we can send more shimi gi denloya ngaji gi tansu bela. Datu ti ngaji ani clinic ti datu achi kuma go to masbar ibela. So the society is also we are also trying to collaborate with JDW and ministry on this. Then we also have a royal command from Ajitrimpem, Her Majesty Ajitrimpem Wangchula. zum mapale tu na tu se suni du wala aji.
Yes.
So we ngache doctor hato lady we encourage any type of this thing la alternative medicines ngaraya ngi ne ngoshi midisulu ani yatsa gembup ki capsule lo dele ani marijuana gi zozo gi ani khachlo ani khachlo ani medicines actually
Hemp oil.
Antuye I give la and it helps.
Last. Dato di mapa ini di ngachi mula cervical cancer gi kole lo lak meba mula, but then ani it's mostly caused by HPV virus meba di mula.
But
Ani ngachi ani HPV virus gi cause baby gi cervical cancer gi tele awareness di ngachi le hashe do bate mula ngachi am supposed to sulu, but ani phogele HPV gi cancer thopni gi nyang khayu yala.
yeah, ani kada game cancer oropharyngeal cancer se labila. Ani HPV ani 16 se chiye bala ani gi thobila. So oropharyngeal tengachi ani boosti vaccine chu midi khongluya ani kachlo ani zum cancer ma babjong bala if
Nachi Bhutan nalu gadibi yoga la HPV cancer thomi in men nalu rate gadibi yoga la ngai gouda di namsami rate di namsami high mi se didi koi, but doctor ki sunsu machin.
I think it's awareness la, because I also look after what we call cancer registry la, which has been established in Bhutan since 2014. The anna tau ani phogegi cancer, pochingi cancer, logi ati mom tendozum thomala. Devoda ani khada ani kemgi cancer di lashachira themila. Te ani di da gachlo kadimchilu HPV duga minuga denga chigi shipche bekop chi dula.
So ani gachlo ani awareness did namsami chinga gi besa di ma thola ngai ani cervical cancer da ani zum di ngai thonchi bola, but HPV cancer in men gi kole awareness di ngai namsami chi ma thola ngai gi infection ma shi langa khacha na doctor lo questions as tini gi tele research chung ku chi beta udalani lege nga hama kola.
Ani mouth cancer, mouth da ani throat ki cancer evala oropharyngeal cancer se ani they are HPV related la. They even in the West it's same la. The ngachina di kadimchi the ani HPV ki thobina ngachi machine digi the datu since we haven't raised awareness, but head and neck cancer se ani kha the ani throat nose and so cancer the number ni ba mebala ngachi Bhutan na stomach cancer ki jable phogena the smoking da kadimchi domagi kadimchi khaini da ansu zadi kadimchi HPV gi ina te ani chu ngachi shipche bego bebala, but jile ngachi ani head and neck cancer gi awareness tisu ani ngemara guidelines zo tele ani Ministry of Health Thatole ani awareness raise benigi ngemara we need to raise awareness among the health workers la khon shego bala, because they are the ones who deal with the patients tengemara khon ani awareness raise be tele chamchi ani midisu mise disulu ani behonla.
Last. Ani mula last I only have about 2 questions left mula. The ani long term the cancer survivors mula cervical cancer survivors disulu ani fear ji diong bate mula the kon survive be di bero the kongi mentally I'm sure they'll ati fear zum chi de ati do dira de dom bate mula ani zum ki tende nalu ati sun sobia la can it reoccur that chachi thasa wachin lodi cancer thopni gi nyang yoga or ma thopni gi tene gachi begoga or mentally the achichi mo dosa de anizum yemi disulu nagi advice sumchi sunsubachin.
I was also going to touch that line. Ngachi cancer thop menchi be drashimlete ngachi ko jani mela we follow them up, and cancer lomidi masura loni ngemagi loni da sumgi na ko lobila te ani bending ngachi nyemagi lo ni da sumgi na kulu tau siji nganga gi bana ngachi besa sipche bio ngachi check bio boila te kongi am be umila te simi dis mashura ani recurrence ki be shi umbala te ngachi gi nepti sulu labi te neji di lobi lalulu long te kalu lon na mishi te ani loru te joba daji majin te che achi 마치기 벤치 조바 짜바진 때 드론 제라 다니기 고갑 예 때 마다루 아치 인림베 데니기 고갑 예세 마치기 안에 랍미라 때 로가 친체 니마기 로니 디 더 시지기 바나보 디기 슐레 더 두두기 바나 로가 친치 보이라 때 디기 잡레 마치기 때 로레 바나 쇼슬라비 가침서 캔서 서바이벌 디 longa deba chincham chi dabbe chi unga chi hadle te longa chi closely follow up yongla te maze masuchi ra ani longa ke shumle bilobe te boda re ni lo chutam gi jable lo ni du te lalu lo sumchu gi jable lo be shi mala te ani wa ta chi nep disulu di lap lap sar hinda te masuchi gi la te ani ngaji Bhutan Cancer Society ki ani WeChat na chuve te khom da Doctor Chu pe WeChat na lolap pe chamchi ngaji boi la nga ni nepta ani Doctor President ngaji ni nepti chude te mi rin sale na timpule telen ngaji mi te ani chato thap me la ani bandi te we involve Cancer Society la
Yes. Ani mula, for young women mula out there, for the young women watching mula, the ngachi ani cervical cancer na mahip since gi tenle like so ngachi cancer mathobni gi tenle mula ta tolera ngachi gachi bego ina la lifestyle changes or gachi gi prevent byonga ani chila.
Ngimara kap prevent kap chugobe dele ani ngachi gi lona chungule ani pogeda dio mabes labi because ngachi gi chimsa ge khap nale pha cervical cancer ma babjumidi chi is because of improved socio economy mela so improved socio economy beuda bumdi su school na jo chol hap te jobanien mi jabe bala te joban te nin hani bendigi te HPV di namsa mi mithobe bala lona chungkule top mi HPV is gi mom ani cancer top ni ning khayela that's why machi vaccination di lona chungkule before 15 years to mi di ani la so they should avoid sexual partners lash because it's because of STI so India le ma babjo mi di chi because of marriage joba ma be chi alu mamma ke alu nyusu ke the chi the STI because of awareness the STIs have also come down so in that men also has a role to play because I find that there are pockets in the country where there is lot of cervical cancer and when we did HPV testing the HPV positive rate was very high in those areas so it means this STI so men also has role to play labi ngachi the pogi disuya gachi chipego bese the pogi disuya agogo be tele chidi smoking is can cause cervical cancer and ngachi tato amchu jem disu lunga gi tam ku thuni yoga so that some of them say they do smoke so smoking prevent STIs tele aludi mapale ngachi tato amsu disugi mike but to avoid early sexual debut avoid STIs kachimasa HPV itself is not sufficient cause there are cofactors so hani cofactors na umila alu lasha ke STI lokchi thop kachimasa cervix drama tupda te ani HPV ye mi jo bala so then smoking also has a role in cervical cancer so this is my advice then of course come for screening ngache datugi ani HPV testing ni ngachira ya 10 chula. It can be done self-sampling ngachira be chula. Many people who are working in the private sector and all, I find that they don't come to hospital because ngachi timing the kung medieval. Ani disudi we can even offer self-sampling la ngachina ura matumi disudi. Te ngachi men khana bio ngachi am ngachi doctor disuda sister disu mazip chi ngachira self-sampling be la because we feel shy with our colleagues la. So ngo chajin the HPV sampling chara bechu tele lo nga gi bana chamchi betu. I mean, no need to repeatedly do la. Look, bimingo singa anibera labila. So these are advice. So if they have abnormal bleeding, ansu yewajin the cancer topnigi and in kada ansu yewajin the joba menkana jena not to be scared of cancer because cancer joba dazimajin down saying lang I katulidi.
Yes. Last my final question la. The mula what are like besides abnormal bleeding what are the other symptoms that can point out to cancer la?
This cervical cancer can be silent la. It can remain silent for a long time. Especially if they have no sexual partners. So if ani poge they have bleeding la postcoital bleeding silabi when they sleep with their partners. So this can be an early sign la. Tengaji ani yumi am disugara colposcopy se ani HPV positive perhaps me na nijidu se themajin colposcopy se beong bala. Tani postcoital bleeding disulue mache gara lu beila. So it can be silent. Kanya made the Najina living on late, Namsam Chisodi, the Daunisum de Chiginangolo, Shumela Amlalo. Karalu, a symptom tendiminula. The Masuji lu is bleeding, ta umarum, ta unigi, nigi, Tauchi Nankolo, ta nini sum ta ten. Anebe beon dele chidi foul smelling discharge that was sami ani male khamlo si themide nam sam dim lam ani cervical cancer yemi disu ngachigi ani besa nana ngachigi room na jiuchira we can diagnose cervical cancer from the smell nam sam thatep ani dim lami dele nam sam chibi gale very late signs are ani phona kepna. These are very late signs because ani am disu dinam some midebela noni sumya lejimbe midebe. That's why we are telling women to do screening because screening beodari tengachigi through the screening cancer immediately dajimebala whether it is late or early la.
Yes. Thank you la. Thank you so much Dr. Lu. I would just like to really show my appreciation la Dr. Lula, like how you are tirelessly working to help women out there la. You're doing it's a very noble profession la. So machigi all our respect and all our appreciation to you la. Namsami katiche la doctor. And if there is anything else that you would want the public and the viewers to know la.
I want to tell women that breast cancer is coming up. So in the next few years, the breast cancer will overtake la. Already, breast cancer is giving a stiff competition to cervical cancer. So, Nigi ani pink gemidi is to tell women to be aware of breast cancer because that will be the #1 cancer in the next few years. Because of our screening and vaccination, the cervical cancer will come down. Of course, because women are now not marrying, not having many children. So breast cancer is a sign of development. So I just want to tell women that breast cancer is coming up. So we have
Ati
to.
Bhutan nalo ani yuya la mammogram kashin
Yeah.
mammogram yumu la tato.
Mammography di duala, but as such, I think we do not have screening go matsuk zum chi la. Tenga chi am sudi lona chungkulu top mebala. 50% of women with breast cancer and cervical cancer are less than 50 years of age la. It's not all women that are getting cancer in Bhutan la. The anibendi the mammogram ro chlivi khale pha bewajin lo ngap chule go chume pala. We do every 3 years la. The ngachina di datu mammogram as such go chuma chula. But with breast cancer coming up, the program might start la. Tatu di I think not enough human resource also and trained human resource tan chu kovela. The ngachi Bhutan Cancer Society hatoli we keep raising awareness that different about different cancers so that people come on their own.
Ani breast cancer gi tele self detecting gachina chanzum bini dum nala.
Self breast.
I saw it online somewhere.
Ngachi ani menghana ani cervical cancer screening bio mindisu low shipchule lona bomb midisulu. I think the nurses are doing self breast I mean clinical breast examination and teaching the women how to do it la. Tatu di ngachi early jubata jini digi ani jamchi ngachi ani am disulu ani tin jimila.
Yes. Lasla, thank you. Thank you so much, Doctor, for your the information that's been passed, the awareness that was awareness nalo pidila nam sami kadichela. So ani Bhutan Cancer Society gi yuvatemula sir karma.
Yila.
Hello la, sir.
I didn't go also because thought we'll make it casual. There is other
Actually, Anira idea diva. Then I just thought like, oh, doctor is such a senior doctor. I should show a little respect. But it's okay la. It's okay. It's okay la. So na yikole atiti sunamela. What like a little introduction on yourself la.
First of all, thank you so much la. The first time we were on the first message and then approach the propose piuchi nagi immediately the Nyeren Zena the support binamelo. Thank you so much. My name is Kamatov Gela. Tengara I beojin yumpulali la tashigangle. Tenga the Cancer Society na zibe the lo ni legi majula. But before that I was in the civil society organization for past 11 years la. So my experience in working in the CSO for last 11 years has come very well with the Bhutan Cancer Society nalula. So dari ngaji awareness tebiani na some midi every month ngaji awareness and advocacy nalu cancer ki be watching right from January le December sense ngaji different cancer ki awareness be wala. So dari ki be watching sarva pindigi doctor has been telling us that 17th November na lubeko now event bebegisan tisenam se mindu TikTok ta Facebook na gati biru bege se anibe the doctor inga chilu Instagram de and then doctor is the founding member and also board director of Bhutan Cancer Society la. So ani biuching achi immediately when we explore and then the first a lot of people recommended Pema Sigila. So much so really effective. Had Bhutan Cancer Society followers like you la, close to 200k watching ngachigi awareness is not so effective to Nimela, but unfortunately.
But Lasso, Namsami, thank you. Namsami, thank you so much, and also to the people who recommended like my show to Bhutan Cancer Society. I hope that it will be as effective. And I really hope that the people will be a little bit more aware of firstly Bhutan Cancer Society and the cancer itself. Awareness so nagidi na Bhutan Cancer Society was founded when exactly, la? I'm sorry.
The inception came way before 2013 la. So Aninalu that time former health minister la Limpo Dechin, Dashu Dechin, the Angi Nichara cancer ki Jones to bala. So she came up with the idea, and then Morada Chigabe, the Lili Wanchu, who is a cancer survivor, along with Doctor Ugyen Tshomo, who has years of experience in cancer. So three of them they came together, and 2015 nalu 4th February is World Cancer Day. Zani coincide be so Ajike Sawamu Wanchu was. She graced as the patron of the society la. Then April na lu bechamchi CSO ki status pe thopchila.
Las. And why do you think that Animula, like, why do you think the founders decided to come up with this, la, Bhutan Cancer Society?
Now
Why do you think, like, what are your own personal experience, and then they want to maybe, extend the help and awareness to the people, ngachira public nalu, ani, what could be the main motive la, of founding this?
now for this anime ngachigi na Bhutan nalu we know that the health services are free in Bhutan. So these three konsumgi found they've gone through this like Dashu Dechini Bachi, she's gone through attending her mother and grandmother and seen all the pain they have gone through. So medically support jungi khatuli matutuk dula, but a lot of cancer patients are facing difficulties in social ki support nalula, psychosocial support this will lack beome say so hanichi kongi to address that, and mainly also to raise awareness to the general public about the preventive measures la. Hani ni gibe kongi found binula.
And kachi what are the services and Bhutan Cancer Society provides la?
The first we work under three thematic areas. The first one is awareness and advocacy, like what we are doing today, right from January to December. The second part is the care and support to the affected individual, the families. It's not limited to Niplucham Chimema Nipki family or affected. So Anina Lunga Sago support area Dindi Chila. The Doctor Ugyen Tshomo past Godambra Jumidi that WeChat ki thokale tele patient disulu charobi midi, we call it patient navigation. So every Thursdays and Fridays our staff go to the cancer ki gachilo ni oncology ki OPD biudalu Doctor Ugyen Tshomo ki biwachin every Thursdays bivila. Doctor Tashi Dendu ki biwachin every Fridays bivila. So anina lu ko nip disu mashura ro they are from far flung ani nale umebala Bhutan nale. So navigate benigi the is complex hospital system nalu gati junda mashi guthom yodalu machi cancer ki case imagine our staff go there and assist them the report katil lenna tha gati jinna doctor gachi kachina sani support we. Then beside that we have 6 other support like machi the patient who require on active treatment who require to come to Thimphu and sulu transportation ki support regime the lalulu Asichi stage Asichi further be jo bero oxygen this go be watching portable oxygen concentrator tele air matrices this support be tele logistics the essential this support be treatment na ta machin tele ngachi treatment na lo petty financial assistance to te sanzumbe 7 support activities hila.
Oh, last. That's very nice na. Very nice. And the Nagi Mula, do you all also have like accommodation this one zumis ani provide bioya la dama chikagi outside Thimphu patients this one buildalu like afa kidney gi ani duba temenala ani zumbe cancer patients
that ngachi nalu and bimidi that exactly that the kidu patient gets house la. So it's meant for patient any kind of case la, any case disease of any case thazuna le o medi so long term treatment chap ani sulla so ngachilu mi la tato abhi kitu patient guest house na ro ani da medi 90% of the occupants are dialysis patient la kidney la so ani na lu ngachi gi rere nire maybe at the most 5 days ko accommodate be van vijay la so in absence of such facility of our own and from the government tato ngachi gi under logistic and essential area nalu we have like 23 or 24 patients whom we are supporting monthly financial assistance of Newton 3,000 la so ani gi asi also ta ngachi gi support fees mira am chimela because of the number of cases that we have to deal with la so ani chi that temporarily ani chi charo bedo la.
And how do you think ngachi as public mula da ngachi as public how do you think we can support la Bhutan Cancer Society in providing help to our patients la?
Lasla, thank you. It's very important. And then the question I was really, Anila, the first thing is ngachi awareness building that we do ngachi we had followers like you ngachi awareness din apse effective journey mela we were on TikTok only barely a year ago la ngachi followers in mummy they any content that we put on the Facebook or TikTok then I'm saying miomela reaction so like Nagizum Khasa Bibi Bachin within overnight 11K de hinula views so ani biodulu follower important too so the Zimi Bachin please follow us la we will be coming up with so many content and machigi shapto gachi pivina phale support bachin acknowledgement and likewise ani awareness so machigi different all useful to the society and bakthula so please follow us la. Secondly, these 7 support activities that support me, the people must be wondering how the unity support me. So we have an initiative called Genuinely Monthly. So where you have the opportunity to sign up as a member. So any amount on a monthly basis. We have a lot of Bhutanese who have signed up monthly, the daily member. The monthly the 50 lalugi 100 any amount of your choice la for the period of lalugi 1 year bhome lalugi 5 year bhome lalugi lifetime bhome la so ani hi la sorry go copy so if you are interested to join as a member then you can message us or Facebook nalu messenger nalu YouTube te WhatsApp ki and switching hi la so analu machi link taung la so machi dari number 50 the 100 the Doma Rajniganda Zunara Judumela, so you 50 to 100 kiti it's Aniking at membership Yani Kokopchi and Hila.
So I will get as many people as I can to at least donate monthly 50 100 Gamchi Bureau. I'll try my best to get in and there are 490 viewers, so I'm hoping 490 viewers people will be signing up for this because this is such a noble cause mula because tato maybe tato nga memo viewer guy memo mula but then love me shiba the cancer so the lumula ran le phoni nyakadu kale anybody in your family lo phoni gi nyakadu bate so anizum na lo let's come together and support Bhutan Cancer Society in making a small little financial donation chunkuchira berula. So I will try my best to get that much from my side. Gadimchi Yumi, I hope you'll have a lot of people who will want to support and donate every month. Because every month 3,000, 24, 25 patients to 3,000 but it becomes too much. Bhutan Cancer Society also. But if all of us come together, then it will not be too much. So I really hope so. We already have a lot of people wanting to join. So WhatsApp didi ngachi katile thopala number na contact china
Facebook page na hila ni Facebook page ki ani open view chi ani page na right hand side na lo WhatsApp ki ani hila.
Lasla. So Facebook Bhutan Cancer Society la. So Lasla, thank you sir. Is there anything else that you would like to share la gachi?
I just wanted to clarify one thing. Ani lalugi and timebala. I wanted to contribute. Ani say that the contribution ki chi ani by being a virtue, by being more virtue ani as a CSO la. Machi civil society organization bindigi ngachi ki fundraising ki the ethics and suila. Bichuk da be machuk. So ani biudalu from dato ngachi ki act labelu deliani biru. We are not allowed to give our account number on the social media. The publicly any better miche. That membership that is our the kind of a low hanging fruit for us in Megola. So it is our day-to-day activity. So if you join Chiragi Bay and the monthly Bimingola, once you sign up, then for the
bank will deduct.
bank will deduct for any standing instruction dealer.
Yes,
So
yes.
with this, finally, I would like to once again thank you very much for immediately accepting our proposal, and to all the viewers who have made time to be with us today.
Thank you, Lama. It is an absolute honor. This is, in fact, been the most enriching and wholesome conversation I've had in my Let's Get Real, especially coming from a very senior doctor, taking the time out to raise this awareness for ngachi zummi ki telemo la ngachi didi atiti mishibe batela because tachutmu ngachi lu namsame ani happen mabini digi ngachi ki hami ko yabala. So for taking the time out, not just today, Nasser also and Doctor also mula. Taking this initiative to make this thing aware that, listen, even if you have the cancer, you can still get better. Se anuzum ge di anuzum hope chi ngale thop chi na viewers disule thop chi la. So that is an absolute honor for me to have such a wonderful guest today la. I really, really appreciate that you got in touch with me. But I was quite surprised when one of your friends contacted me. But then this is a wonderful opportunity for me and my viewers. So thank you. And hats off to whatever you are doing. It's ngachi didi ngachi dup sera doyap me da ngachi mi gidi da ay charo bigo me se ngachi gidi khagilap me, but you all are actually on the field doing it la. So I really, really appreciate it la. And Kade Tata, if there is any time you would want to, come and talk, I don't know how much of a difference it will make, but anytime you feel like you could use like Ngagi platform to pass any message, anytime, please do let me know. I'm open to it.
Thank you so much. Someone was asking about the office location email. The office location is very close to hospital. The reason why is at the old Finsum school, Finsum private school, which was in Changsamtola. Now the school is closed. The main kagi all hospital Kalabaza Josagi Lamchi, the wall, the Tetira closed up, Tetira open, Chabi, and the wall, the Olira Yila. The motivation member, I'm not the founder, the founding member Consumi, Doctor Ugyen Tshomo, I'm Lili Wanchu, and Tasho Dechin Wangmula, the three of them.
Yes. There is one question by Dema, and she's saying she's been bleeding for 3 months. You have to immediately go to the hospital for checkup, Dema. But they say it's normal.
I'll hand over to Doctor La.
Last. Doctor would be able to answer better. Hello, welcome back. So now we have some questions from our viewers, if Doctor would like to answer. Ana Dema semichi dubala mo dosumgi tende she's been bleeding se labde lola. Then menkana juda di normal in se ane labde se labde se la.
Maybe she's taking kapsu ane bewat jindinga che normal member ane kapsu me am disulu lalulu taong che matupe denila. But we never.
The contraceptive.
Oh, DMPH. Nimna ani Sumitsu cup and a tatin de miller lalo. But ani am disu the cup suchira babajin, Komazawa cup suchira devajin, then Nimchibioda tire miona kondo. The more Majiki tau me am disulu ultrasound be Tadi Gatele Omega, Chicale Omega, Nanale Omega, Garashipchi Bila. The Anna Matawajin, actually, we never say it's normal.
So, Dema, you might want to go back to the hospital again because
age perimenopause se ani ngachira amsti chu tha cheni remda tha mauma de omda yin rimbe om ani beum bala te like that lochi tha maum da ngachi gi te tata chepe chi on menopause pe so women in perimenopause they have all these problems that many of them but usually we never say someone is normal when they have bleeding like ngachi men jini wala cheni men
Less, less.
whether all these
Dema,
things
please go back, okay, la, and say that Dr. Ugyen Tshomo asked you to get checked once again.
she can
When
come
does
to
this? Hey, go to doctor. Okay, Dema, please go to doctor and get checked once more. When does the screening program in Bhutan start, la, lol?
actually ngima ngachi late Mrs. Norbu da dele Dr. Mahanta se Guwahati le Dr. Chi deila khoni gi ngima le go chuna la when I came as a doctor in late 1980s pap smear was already there la but ani program be di miwala
Yes.
so program be di 2006 le jamchi go chuchila whole nationwide program be la 2006 le 2020 chinchi di pap smear be la 25 to 65 years ki amdi chulu lo sum bana kachim je pap smear has a chance of missing say meba that's why you need to do immediately.
Less. So Tshomo, you got your answer right. Pap smear the namle. When is the right time to do la? 20s, right age.
Pap smear the I said pap smear gidi ani ma duga tawi se la
The HPV.
from 25 to 65 la the dato HPV ding ngaji 30 years le 65 years be la because HPV di lona chungkule ngaji gi sipche chabaje namsami teo te khorara ye joni gi neji me bupi me ba so we avoid doing on young women la and cancer cervical cancer is very rare in 20s lo ni sum bana re ni la miten la ani 20s na cervical cancer
Yes. Is pap smear only for men lo la sangi children? It's you ani HPV testing domina ani di bente after 30 baby lo 30 to thing 30 to 65 lo.
tero WHO gi biojin 35 to 45 na chasum bedaba chin te anim chigira tupse mela deboda ngachi gi di ngemale ani lerim di debe yendigi te ani mazola so maybe in few years because now all women coming for all new women joining screening are vaccinated la hanbendigi so we might start from 35 and bring down the age of stopping the pap smear also la ani screening also la
Less. Sometimes twice period in a month lo chodu kila. So it's sometimes that's normally like when you have your periods twice a month.
some women have what we call mid-cycle bleeding la mid-cycle spotting long lalulu anebe ome but ngachi besa de any bleeding in between periods ngachi gidi ane mapale sipche beong la especially ane cervix na ane shatep ome bala polyp se ani bana komle thaten ani beong la tani minuga kachibe na infection gi imega cancer gi imega polyp gi imega ngachi ani chachu be taung la anyone bleeding in between periods la because it's one of the signs of cancer se lagi the tissue bola so we make sure all these women you don't have this la
Yes. Analogy tu bola HPV DNA testing you Bhutan nalu yoga se dula.
that is what we have la
Yes, this is exactly like
after
HPV DNA testing dula Bhutan na.
Now that's the only thing we have lah. So if HPV do se wajin delenga che ani liquid based cytology se peps me anan le chaum la. So we do both lah. Positive emitulu, the negative emitulu di the longa ki jable HPV ra bechubila.
What about bleeding heavily continues for weeks la doctor lo? La James. So ani biochin di min kana la.
Can be because of ani fibroid law. There are many causes. So we always do ultrasound and gara behavior we treat la. So sometimes many times we treat with medicines, but sometimes women end up having to remove uterus la.
Ani will ovarian cysts have an impact on pregnancy lalo?
Ovarian cyst chunku some women have ovarian cyst in pregnancy. The chunku yebachin ngache gane benime because it might disappear. But Bombay yebachin we operate la. We operate in second trimester. Second trimester means dausumda dugi nanalu achigi operation jamla. Tinge maya mibe di shulia mibe. Kachum se ache. The ani ovarian cyst yebachin uterus expand be machuba. Ani alu tenju ni nyingkai bala dau macham alu ke ni nyingkai dele some can be ani cancer ni nyingkai bala re ni we get cancer in pregnancy also la ovarian cancer dengan ji treat baby la ovarian cancer ovarian cyst da but it depends on the size and all la.
But some women with those ovarian cysts, Yumi Disugi, can they get pregnant la?
They can la. Chuku be wajin di ka namsam effect mio la. They can get pregnant la.
Ani will UTI lead to cervical cancer lo sala?
UTI is completely a different thing. Ani chapsa deep na meba it has nothing to do with cervix like lamra so yin chapsa deep ki lamda alukesi ki lam so ye bala the alukesi lam cervical cancer the alukesi lam na le temeba the chapsa deep da chapsa gap the alukesi ki lam gi dongha da japkai bala. So nothing to do with UTI, but some women with cervical cancer do come with ani chapsa tete ga chapsa chu tete ga ani zum tenidula, and this leads to late diagnosis because in the district hospitals ani shipchi lejimbe mabio ani BTI be treat be shasha bom bala dau be. So it can be one of the symptom la ani late, especially ani women with late cervical very advanced cervical cancer, they can have ani repeated chapsa lok game se lapmela.
Ani mula does chemotherapy stop menstruation la?
The ani tachinga junigi ani no samta de bala ani chemotherapy it will depend, but most of the chemotherapy ani menstruation the fertility effect mibela ngachi ovarian cancer one type is seen in young women, so many of them are alive after surgery and chemotherapy, and some of them have given birth to children also. So depend upon type of chemotherapy la. But with radiation, cervical cancer yumi amdisu, no matter what age they get cervical cancer and they had radiation, tamyon la, tamyon aluya myon la. So that amdisu ngachi ani lokleshim le ngachi we tell them la. The kaktabe bemengo chelu tamyon aluya myon, and many of them have menopausal symptom then. So menopause ani don't ba nina ten shani matu dele kansila sina ani zumbe. So many of these women, young women in their 30s and early 40s, ngachi menopausal symptom gi ani treatment jimila kon local shimle.
Yes.
Radiation is the one that will stop the radiation to the uterus la. that will stop ovary sectum bala.
Yes.
Ovary cells tissue they don't multiply anymore imela radiation bish chemo gi di mabela chemo as long as we keep the uterus and ovaries one side ovary they continue to have menstruation they also conceive after marriage la young
Yes. Why odor discharge every day still of the sala?
ani discharge lu take a lip dadi ade ngachigi ani HPS discharge 10 be shipchibini bala anna masura ganiam bi themela actually the most common STI ngachi chlamydia si bala ani di ngachi mita ngachi dulu ani diagnosis pini facility menula
Yes.
so this is an STI la. So when we treat women, we treat STI married women. This STI the any bacterial vaginosis la. It's not STI, but ani this is common la after menstruation due to repeated washing. Ani I think even condom use here because many women who come with discharge when I ask family planning, they seem to be using condoms la. So ngachigi di namsami lok machu se we say that la because we have many bacteria there ngachi chu be the bacteria disturb yung la so the new good bacteria die and the bad bacteria come grow and that causes foul smelling discharge the midisugi di foul achichi dimlam chi cancer imdes no mabala but cancer gi discharge di ani omdisugi bolahara jamisula
Oh,
very different foul smell la.
Ani heard that the use of IUD birth control will lead to causes of cervical cancer. Is it true, Lalo?
Nothing to do with IUD has nothing to do with cervical cancer la. But if women with IUD misbehave and have many partners because she's now sure that she will not get pregnant then she can have HPV infection which is a cause of cervical cancer so IUD itself has no this thing nothing to do with they used to always blame family planning for cervical cancer khap chu di cancer thop chilo men za di khap ani cancer thop chilo ani copper ki khap loop ki thop chilo se they blame la but me la
Yes.
ani I pill se de bola which is very very popular among our women that can cause because condom is not used the honey when you can get STI and later on you may not have children because STI not treated has a long-term effect on some women both men and women
What was the name now of that thing? Pill?
I pill says I'm still married garagi zadet mela and it's a form of family planning la. So women become careless by taking that medicine, so they'll get STIs la. So it only prevents pregnancy. So I always tell young women not to do that la. Then married women should not also use IPIL regularly because they have regular sexual partners, so they should have proper family planning because IPIL is not as effective as other family planning methods in preventing pregnancy. So, family planning is
On a Tshomo semigedubala, will immunosuppressant drugs lead to menopause for SLE patients, Lola?
Immunosuppressant drugs, the HIV, amdisuludi, and HPV, jola. So, according to WHO, these women should have screening from 25 years of age, and we should do every 3 years. So menopause da nyam di mila, but HPV infection ye bajin ye jomitu bela because of immunosuppression la. And it's not a hormone bendigi. I don't think it will. Autoimmune disease imala SLE semidi. That itself can sometimes attack ovary la. And some do come with early menopause, but many member, it's the disease itself la.
Yes. And the question is, nam same question dula na Dr. Lu. I always want to know karma kelvine dula.
After the performance of endometrial, how long the bleeding? Mema ani am tate medisu lunga tigi ani biopsy si chap ni bala endometrial biopsy pipe chungku chi chuwe ta ani chu shumle tha kharimji lu cheong se me usually nga che biopsy chap shumle tha chi ni men detail jimila so bleeding should so treatment majin te bleeding may not stops sometimes nga che biopsy chap shumle report malip chin chi men mi psimala they may continue to bleed.
Oh. Yes. So, difference between contraceptive pill and I pill.
Difference between contraceptive pill the nimre chara zaungbala OCP se mekhanale thopni duba nim khechi yanji nim khechi gegi men normala ani nimre chara zago the ani sexual contact kingima all the contraceptions are before sexual contact la. I-pill is the only contraception that is taken after the sexual contact la. So I-pill it may not that effective in preventing pregnancies la bilanga ji te nyen chachap phoge ten yemi disudi te ani normal pill disa la not I-pill the forget then may forget amsu recap chap chip chini me then I-pill is okay la. But if new partners kalhile danyam bewajin then I say you may get STI pregnancy prevent beru STI maybe so there you have to use it's better to use condoms machi hatoledi new partner.
Why is abdominal cyst formed and what are its consequences la se chi dusala?
Abdominal cyst se di mebala ganche ovarian cyst semidi
Ovarian cyst.
Amsu jim disu before menopause many women have some cysts but many will disappear and in many they'll disappear with medication la ngaji ani system disu ngemara thawon shumle lok tawi in many it will disappear then disappear mabe wache ngaji men daw sumle chi sa chuwe then again it will disappear the disappear mabe mi disu chamchi ngache ani cancer imega member ngache thalera hago bola thachik chappe tele operation chapila so cause the mishila some are physiological some are ani gachlo ani cancer ani be chiung la chi
How about husband with multiple partners? Can they bring HPV infection?
Yes, because we always say cervical cancer is more common in women with multiple partners or in women whose husband has multiple partners. So it is a thing, risk factor. Husband behavior. That's why I'm saying now men also should start thinking because there are pockets in Bhutan where there's a lot of cervical cancer and HPV HPV chapters 80% of women positive to the HPV. So it means that area has lot of STIs. So men also now, I think, have to think that konluya cancer topni yebate. The kongi cancer ya judo that ni lore chara.
Yes. Doctor, my period is coming twice or thrice, Lola. That too, visiting hospital. Can you explain? Twice or thrice a month?
Hani zum temi disu lalu I pills azawo meme. Because ngaji family planning do the kon I pills azawo meme lalu. But we always make sure that ani ma cervix le me mega tawila. And then we do ultrasound to see uterus kinana ka che menoga tawila. So it can be anything, but they should come to our OPD la.
How dangerous is yeast infection? Will it lead to cervical cancer, Lola?
Male yeast infection thing ngaji antibiotics the diabetes yemi disu dele ani pills oral ani family planning pills sami disu hansulu umala. It doesn't lead to cervical cancer. It leads to a lot of itching and all. So, STI yeast infection.
There is somebody here who's done LEAP and result was normal in pap smear but still discharge yellow in color. Is it normal? Say Tidil.
The thing I forgot to mention, ani ngaji amsudi to HPV positive screening positive 10 dele leap lo dele thermocoagulation menchi chapni wala ani cancer to ni ma ye ni di denlu lalu hysterectomy alu busa 10 town hani disu di they must be followed up carefully for the next 20 years la. They are at risk of getting cancer 5 times more than other women la. So we have many women who were lost to follow up and got cancer after treatment for pre-cancer la. So if women who had LEAP or anything, no matter whatever the report, discharge 10 men jimda drama to pyo janga che ani colposcopy se midi ani mapale beila.
Yes. So you might want to get a colposcopy done.
Mema ngemara jas di ani men chip jinta madaba chincham chinga chip boila.
Yes.
Ani lip bemi sudi ko ani lokti HPV lo chilu begoba. Danuga madabega tawila ngachigi. So discharge we are a bit more careful compared to other women who had no HPV infection la.
Yes. Oh. Yes. Will what is fibroid disappear during pregnancy, Lalo? Kachino?
Fibroid one.
Oh, okay. Nothing. Fibroid. Sorry.
More of
Fibroid.
the uterus it disappears after menopause. It will become smaller after menopause, but in pregnancy, in some it becomes bigger. It doesn't disappear because it's hormone gi mala. The pregnancy the thing achinale amsugi hormone lasha theumba. So in some it will become bigger la. So in some it may not change, but after menopause remi disulu machigi operation and sumibela because any fibroid korara chunku jong korara ye jong se anyway labila.
Yes.
Doesn't become cancer la fibroid thing. It can cause a lot of problem like bleeding and pain and all these things la.
Yes. TD, can a woman with one kidney become pregnant? And if pregnant, is there any risk, Lola?
Me, they can become pregnant la. Ani kidney tumi disuya ani alu keomela.
Yeah, I sent an invitation to someone. I'm so sorry. Don't accept it. Last. Last. I have HPV infection. It comes out positive and told me to wait for 2 months for the confirmation. Se dhula chilo.
Ma'am, ani HPV gi ani report ti jawab mithop lang aje. It takes we had ani screening gi ani machine di mengha sumna chamchi chuchiba la kelibu mongar da na thimpula. So somehow mongar and gelibu lu ani nam beni minula. So all of Bhutan le na thimpu lu tamme ani benigi te report thoba dauni le chakap sumya gomela. Te tiboda gi nangko lu kanya mi bela cancer to me am di chue ma che menji go chu lu dau chi ni de chi goila. So I always say nothing is going to happen to them.
Last.
And report cook tip dala.
Last. Can kidney recipient have normal pregnancy lalo? Tup latin. Tup se sunde.
Ani pregnant wonru ngachi close follow up beung la. But
Severe cramps ki cause di kachina mula.
during period inala during period di lalulu mapale chungku ngales ani severe pain beung bala. Tiboda in some women, especially women who are not conceiving, it can be due to a disease called endometriosis la. Ani namsami thaumda namsami shube naula. Then in women adenomyosis se nejijiteni. So they have lot of heavy bleeding with severe pain la. So there are many causes, but it can be some women have lona chunkulera traum da nami bala. The first 2-3 days na dele sound wala. Whereas endometriosis seminar na de traum sashimne na dira deula. We look for causes la.
Yes. Ngachi ani since doctor is also a gynae mula. Bhutan nalo IVF ke option you mula.
Not yet. We are trying to set up, but we sent to Siliguri, and many women who have not conceived, they've come back with pregnancy. 9 years, 10 years, Yumichuero, Alu Chabe.
Yes.
Now we have, and it's much cheaper in Siliguri compared to Bangkok, Delhi, and Kolkata. Ani Bumni de Chikina Colorado, and Menche Bebe Umela.
Ngadi, I feel like so blessed to be a Bhutanese la. Ngachi Bhutan nalu di sogi country the mado be mula nani thani achi serious be na yo bachi ngachi shungira sponsor be di ma tani ani zum dikhate me bo mula ngai I just feel so like blessed la, like thinking like ani cancer patients da ani disu tamme ba me la ngachi Bhutan nale Calcutta Delhi and Sumtani Dubati Mula. So on those lines, I was saying that we are so blessed langachidi Bhutanese Bay and Abeta.
Sikkim, the Indian government is sponsoring IVF la. Sikkim gi amlash Siliguri loot. So I found out that this is paid by the government la, because infertility la me rap chini nyeng. So one of my friends in Guwahati who has an IVF clinic, he says Bhutan has very small population. Without treatment of infertility, your race will disappear. Say, ani log lap ni la.
Ani Siliguri na hospital gadi na mula.
There are many hospitals, but we have contact with one hospital and we send to that only because some women go to other hospitals, spend 5-6 lakhs and come back with no pregnancy, and they come and complain to us, and we find that there are people dalal nagachina masete shemi me khana lepa ke phimala. na tamila ngaji. Te kongi ngacheda nyam lo lappe so tep beniru ngacheda nyam lo lappe chamchi beomala amdi chulu.
Yes. Yes.
But in the next few years, I think IVF will be there in Bhutan, and it's high time that.
Yes. I have thyroid problem due to which I have irregular periods lalu.
And that ngaji thyroid ki mapale ani themila irregular. Di ani ko thyroid ki men zadia sound de ani thadi shube o majin de shumi oni men jamchi bimila ngaji. Why period not coming for long duration like 5 months or 4 months? Ani period lejimbe mau dau sijinga nga demi disudi ngaji PCOS laumba te ansulu di ani nyen chap simle alu miome ba te ngaji khatuli di ani nyamsho silabi. Many women with that problem are overweight or obese. So ani ludi ngaji PCOS labila. So if they can lose weight 4-5 kg dechi nyam papsuru te aluya thelo period thelo aluya ungula ani PCOS midi it affects many women la ani gia infertility caused by mabala because women do not produce eggs every month. Anbeni tha mau alu myo meba te kongi nyam ngate nyam shu chubi te andanya me tha mau ma chinga chi diabetes ki men jimila metformin andanyam tha lalu aluya chapmela. So keeping weight in check is important even for fertility mela.
Oh, left breast with too small boto, but when done ultrasound, they say it's just fats, Lola.
Low, if more than 40 years, maybe they can do mammogram or there was ultrasound na ganya minusi wachin mibela mammogram ya.
Yes. Can a woman at age 39 or 40 plan for second baby, Lalo?
Yes. Kimi alura go wachin but machira amsul lona ya joda ani alu abnormal kini nyengkhat achichi mambala. So that they have to think that.
Yes, Madam Prema, our actual schedule is still 1 p.m. But since your host is up to you, before that, Karma Kelvin ki maluchi dijanula if he can come up, say la.
Yeah, last. I was waiting for the questions to be finished, and but doctor gi lunchtime. I don't want to keep doctor for too long. Also, maybe we'll just keep it for another 5 minutes, and then we can think mula. Another 5 minutes, and then disconnect bege mula, because doctor lunch ki time renewal. I don't want to keep for too long. Hello, la Karma Calvin.
Kuzampo, doctor.
Chala.
Just one question la ani ngagi timidi mula. Tarangi pam lo cervical cancer yobachin nyenka yuya la ngachile topnegi.
It's not supposed to be genetic like ovarian, breast, and so the 15% dechi ani genetic pe. But cervical cancer genetic may seru ani we have few cases where both mother and daughter have cancer and or sisters have cancers. I think rare, but it is possible in men.
Doctor, ada cancer bak show through blood ki khunchi me mo yang na test sosora bili gelena.
Cancer, colon cancer, ovarian cancer, liver cancer, there are group of cancers that we can diagnose through blood. But many are diagnosed from ultrasound and CT scan and MRI and even X-ray. These are radiological diagnoses. So blood plays a we suspect, but we always confirm by any either operation or biopsy or confirm biomala. But blood nale we can suspect lah, especially any stomach ya ngaji any cancer topsim follow up build ngaji blood later follow up that any CA lo any tani ji na. So many cancer patients that come for follow up, we do only blood.
Ani mula, at the age of 25, if a girl hasn't gotten her periods, is there like kachi cause in us?
The cause can be anything like in some the uterus chunku ve o in some it can be ovary mew. So we check blood, we do ultrasound and clinical checkup, and we tell the girls like about the period. So in some but if uterus is absent, we are unable to because IVF, the rogi uterus use base like surrogacy.
Mi surrogacy di Bhutan na mimo la dato.
Men dato ngaji IVF ra me bala. IVF insumle surrogacy getting ngaji law go la. Just now in Bhutan we have no law or no on policy or law on infertility treatment la. So that has to be in place before we do IVF la.
Hey, there is one, sorry, I have done cold coagulation and didn't go to hospital for 2 years. Problem with hengalalula.
The cold coagulation japsum lady and HPV chapote looked it, ma.
Yeah, so mommy and son, please go to the hospital and do your HPV, okay la?
Anyway, leave message. But women forget la. So this is one. I'm saying now we have quantity. Enough women have done screening, but quality will hit the amsidi sugia jome, konginga chigiso se the miome, the nachikatulia jiwaiba, nachigia ko dazi bebe, chebe, bogovana. The anidi, it will depend upon the nurses who are working in under us. Because nachi time mitovala. Yani colposcopy semi clinic na yemi sister DCD ani didu ani zoom report tino ani di menche be no mabega menche be wati pe no follow up be no mabega hani tan ni dami sami khachela quality has to be improved in our screening program because we now cancer in women whom we had treated in the past for pre-cancer and lost to follow up. And they come with advanced cancer and they die now.
Oh my God.
Doctor, I saw one question saying, can urine culture also find some problem? Other urine culture ye konchime mo wada?
Cancer, yeah, mito. Urine culture is only to look for bacteria in urine. It's not for cancer.
You don't know, prostate zimula ingra lekpu mangila.
Prostate cancer is very common in the West, and it's commonest in African men. So, if it becomes big, then hyper BHP say it will cause people cannot urinate properly and all, and they also cancer imega we do something called PSA cancer in the mena. So the small prostate I don't think has is any problem, but surgeon mendi I know bit about cancer, that's all.
Yes. Animola, LEAP negative, HPV positive, is it risk or normal? Sila bisala?
Follow up, follow up.
follow up. SP, can you go and follow up lah? Follow up Chimu.
Ani dachi ani molar pregnancy
Follow up gitu le.
molar pregnancy gi cancer junga se ani chi di wala. This is an question la. Sometimes the pregnancy na aluma thema ani nijitheni la. We call it molar pregnancy. So in these women must do blood tests weekly and monthly la. And some of them will need chemotherapy la. Cancer sumbera phachu phejo la. Lungs na ji, liver na ji, koto na ji. Te hani shini ning khayu. Ngachi choriocarcinoma se labi. So molar pregnancy yemi am disu we must follow up la. If they are lost to follow up, then they can come back with advanced cancer later on. So about 20% of women who have molar pregnancy, they need chemotherapy. So it behaves like cancer now. It spreads to other parts of the body. So, machina yula choriocarcinoma.
Yes. My wife has ovarian cyst. Is it dangerous and will it cause cancer? Sidusa lachi.
Ma'am, ovarian cyst means atara follow-up. We always do a blood test to see whether cancer is only in
Yes.
And if it becomes big or if it doesn't disappear, then we operate.
Yes. Somebody has asked, I did HPV test and result is positive. What does that mean? It's cancer real la lula.
Ma'am, I colposcopy se mi begola.
Turut test so follow up test begobela kom.
Colposcopy se mi ngachi Gynae gi beombola. Whereas HPV testing is done by nurses, whereas colposcopy is done by gynecologists. And we have these clinics only in 10 centers in Bhutan, and we do once a week. So ngachina timpulu di lutipu da na ngachi JD na beom. So we have only 10 centers where this colposcopy is done. So all women who have HPV positive, ko gatelu HPV dega, gatelu ani pap smear dega, hani gi sister di tumi dazi deve, colposcopy gi sister da yam appointment zove tangola. Te ani se mabewa te am disu gagam tang. We do only on Tuesdays. So this woman, if she comes on Wednesday from somewhere from Bhutan or Tongsa, then she's in problem. So ngache khaturi Phagi sister Dichugira, the appointment Zove Ungos Divala. This is called linkage between treatment and screening center.
Yes.
Doctor, ada HPV kan show cancer nyong ni drug pe chance chamuna.
Yes. HPV is a cause of cancer. So cancer, if early stage, if treatment can be done, they down. The national date for treatment be much then we are unable to save the human.
Ani danja mula. Ana ekuna Bhutan chike de nale to be biopsy chum biopsy ha ichko doctor.
Biopsy.
Ada result ga hana mala ani signala ni ada no trust adi kapum nada.
Yes. It can be due to infection, it can be TB, it can be cancer. So infection, no need to do anything. So TB, we treat. The cancer, then we look for cancer. So in Bhutan, due to late diagnosis, many people come with photo in the neck and the cancer came. Then we cannot find from where the cancer came. Then the people die without diagnosis. Yes. This is very
Yes. Doctor Dangachi anevera be watching so much. The anevera imbachi questions the zoni zumchi minula and doctor ki lunchtime and no I don't want to keep doctors been here with us for almost 2 hours and mula doctor. Is it okay?
Chila. The Chanyamgi 1,200 mi no chitanula. The Cancer Society lu Japchur Beru, Cancer Society lu Chauru Beru Mola. Membership re join be the Cancer Society ki Chala Nami din some relation Zume Sero na Doctor Disumachi Jimmy Jessay. Rea Romeo Ashigi Matutuk that is Japchur do. Anibet the boom this year that the Dizumi Badio Megana Joe Tit Bena Anichi Mado. If you really want to support cancer patient, please be member Seshurula.
That's like for the message, Karma.
So thank you. Lanam sami kadiche la to just quickly to our doctor. Lanam sami kadiche doctor like all the more respect lanam sami like doctor zoom yu dinga chinam sami thosanu la ngachi gi Bhutan nalula always trying amula nam sami ngachilu at safe be jani gi nam sami tsagende la so nam sami kadiche la doctor.
Thank you for your support also.
By the way, my mom said hi la. My mother is Amzamla, public library.
I know her very well.
Yes, she was saying, doctor is my friend, so say hi, say love the wala. So last na jajavina nidi.
That's lovely.
Thank you la. Thank you so much la.
To all the unanswered questions, we are still there. We will be active on TikTok, so we will note it down. Though we are not technical, medically qualified, we forward to Doctor Ugyen Tshomo. Doctor Ugyen answer the Jimmy Doctor Tshomo content is over and finally, the Karmakel will be in the viewers 1.2. Please support being our member. Support WhatsApp message Thank you.
Thank you. I'm so sorry. There was one important question, but doctor left. Is it possible that pituitary gland tumor turns to cancer sedusa? But I think the doctors left. So Blossom, I'm so sorry. Just one last question. So sorry, doctor.
Pituitary gland tumor thing, but most of the women we treat with medicine. The bomb to our chinchamchi and operation chapter 10 pound. Most of the pituitary tumors will come with a charm new one. That's a moment. The master of the Charlie Rashid. We do prolactin to charge it after cancer, the water and they need treatment. The operation chavilla bomb.
Last. Thank you. Nam sami kadichela. I think that was the last question. So nam sami kadichela. Just keep calling Dr. Vaidya. Last. Finished. Amchi bishagi mola. Doctor last.
Chiani Ngachar Cancer Society look at the members in Islam, member in the Achusa, should follow the Church of the Chapter Sena Shudola. If you really need to know more, Cancer Society office na jo visit that they would really help you.
Yes, so I know like there's like 1.1k viewers. We are all going to come together and we are going to support Bhutan Cancer Society la. And also, Mula, while we are at it, Mula, in case there is somebody who's already done test and yan positive with him, the hospital show, doctor show, check java show, se lab mungup chi bera, karan moni tashimi me Mula, and isum lab mungup chi bera jo, regular checkups, follow up checkups, this bena singani chi request in la. Because Mula last minute, ngaludi kache mi beseno. Bedu tele shule dazemi gale di atisi chicken junige nyakadugala so anama hibgi hema to cure besuk dara jube please check up benar follow up the sukachi bego misu hospital gi kachi la midi and follow up be the bekati chana se junive la tanga chi jungi de anem chi service to hake de mola but rede lu di ngachi ro be misu ba temola tanga chi ngachira anime lang rara sagi so di ati important yobachin jobe follow up big and please get checked properly la ani chi juni la So, and thank you so much, Bhutan Cancer Society and Karmala. I really appreciate. Thank you for giving me this opportunity to talk to doctor. Hema biochin dinga doctor the chica face to face. Will minam sa dong. But it was so nice. It was a very casual, very nice conversation I had. I learned so much thanks to you, Karma sir. And thank you, Karma.
Aupema. Next time, why can't you bring other doctor? I am a cancer doctor Tashi. The doctor. He's also a cancer doctor.
No, I know Dr. Tashi Tendo.
Hani body bus.
by subject for this monthly cervical cancer
Last. So thank you, thank you so much. I don't want to keep you too much because now it's like way past timing that he build. And this conversation will be posted in my YouTube maybe in the next 1 or 2 days. So for those who've missed the live, can please go and watch it because there's some very insightful knowledge. Dr. Gi has answered as many questions as she could. So please, Nichi Benala, Tugala. So thank you, Namsami Kadichi Karma, and we will meet again. We'll come again live, Bhutan Cancer Society live, or anytime you would like some support from my side. I don't know how much of a difference it will make, but I'll be there.
Ada,